Paracetamol. It's a medicine found in nearly every medicine cabinet, a staple for relieving aches, pains, and fevers. But what if this common drug posed hidden risks, particularly for older adults? A recent study highlights potential dangers of regular paracetamol use in people over 65. It suggests a link to gastrointestinal, cardiovascular, and kidney problems. These findings have significant implications for managing pain in older adults. The study, published in a leading medical journal, involved a comprehensive analysis of health data from a large cohort of patients aged 65 and older. The researchers, led by Professor Weiya Zhang, a renowned expert in geriatric medicine, examined the medical records of over 200,000 individuals. This included individuals with a history of regular paracetamol prescriptions and a control group with no such history. The study period spanned several years, allowing researchers to track the long-term health outcomes of both groups. The researchers meticulously controlled for various factors that could potentially skew the results, such as age, sex, body mass index, BMI, smoking status, alcohol consumption, and the presence of other health conditions. This rigorous approach strengthens the study's findings and provides greater confidence in the observed link between regular paracetamol use and increased health risks in older adults. The participants were drawn from a diverse range of socioeconomic backgrounds and geographical locations, enhancing the study's generalizability. This means that the findings are likely applicable to a wider population of older adults, not just a specific subgroup. The study's large sample size is one of its key strengths. It provides robust statistical power, making it less likely that the observed associations between paracetamol use and health risks are due to chance. The researchers used sophisticated statistical techniques to analyze the data, ensuring the accuracy and reliability of their findings. The study's findings revealed a concerning trend. Older adults who regularly used paracetamol were statistically more likely to experience a range of health problems compared to those who did not. These included gastrointestinal issues. Regular paracetamol use was linked to a higher incidence of gastrointestinal bleeding, ulcers, and other digestive complications. Cardiovascular problems. The study found an association between regular paracetamol use and an increased risk of heart attacks, strokes, and other cardiovascular events. Kidney problems. Long-term paracetamol use was also associated with a decline in kidney function and an increased risk of chronic kidney disease. These findings are particularly concerning as these are all common health issues in older adults. They can significantly impact quality of life and lead to further health complications. Perhaps most striking was the dose-response relationship observed by the researchers. This means that the risk of adverse health effects increased proportionally with the dose and duration of paracetamol use. In simpler terms, the more paracetamol an individual took and the longer they took it, the higher their risk of developing these health problems. Professor Zhang, in an interview about the study's findings, emphasized this point. Our research indicates that the risks associated with regular paracetamol use in older adults are not insignificant, particularly with prolonged and higher doses. This dose-response relationship is a crucial finding. It suggests that the harm associated with paracetamol is not simply a matter of individual susceptibility, but rather a predictable consequence of prolonged exposure. This finding has significant implications for how we approach pain management in older adults. It underlines the need to carefully consider the risks and benefits of paracetamol use in this population, particularly for chronic pain conditions, and to explore alternative pain relief strategies where appropriate.